Good evening and welcome back to the Big Sky Virtual Town Hall. I'm Joe O'Connor, Editor-in-Chief for EBS Newspaper. Before we begin tonight's show, we received some scary news earlier today. Lauren Bow, Board Chair at BSSD, who was planning to join us as a panelist this evening, was involved in a mountain biking accident over the weekend and will be unable to join us. Our hearts and prayers go out to Lauren and his family. We wish him a quick recovery. Get well soon, Lauren. We've been hosting these virtual town hall sessions since March, and this is now our 13th episode. My co-host, EBS local editor, Brandon Walker, and I have learned a great deal from these town hall interviews as we all navigate this long road of a pandemic. And we have got a show for you tonight. In the face of COVID-19 this past spring, schools and university campuses across the country were quick to shut their doors and send students to the online classroom. Many struggled, many saw success. Along with businesses and organizations around the globe, schools and universities have worked this summer to build plans and curriculums that would give students the best opportunity to learn effectively while keeping them, as well as their faculties and staff members, healthy and safe. Today was the Big Sky School District's first day back. Some schools are putting students back in the classroom full time, supporting what the United Nations last week warned would be a, quote, global education emergency if kids didn't return to classrooms. Other schools are strictly online. Many are some mix of the two. Tonight, we're going to learn how Montana and some of our local and regional institutions are handling this complex situation. We've aligned an excellent panel. Brandon?
Thanks, Joe. First off, I'd like to thank our sponsors this evening, the Bozeman Health Big Sky Medical Center, Shore to Summit Wealth Management, and the Big Sky Chamber of Commerce. As Joe mentioned, we have an amazing group of panelists for this session. Nettie Breuner, the head of school at the Big Sky Discovery Academy, will kick things off. She'll be followed by the Commissioner of Higher Education for the Montana University System, Clayton Christian. Then we'll hear from Dr. Cruzado, the president of Montana State University. She'll be followed by Dustin Shipman, the superintendent for the Big Sky School District, and we'll round out the evening with the professional medical expertise of Dr. Maren Dunn, a family medicine physician at the Bozeman Health Big Sky Medical Center. Joe, I'll send it back to you to get things started.
All right, thanks, Brandon. And let's go. Nettie Breuner is the head of school at the pre-K through 12 Montessori School Big Sky Discovery Academy. A Stanford grad with a master's in education from Lesley University, Breuner has been an educator in the Big Sky area since 2005. She has now been at Discovery for the past 5 years. Nettie Breuner, welcome.
Thanks, Joe. Nice to see you.
Great to see you too. Discovery starts school on September 8th. And you're planning to operate in-class live programming. How are you and the faculty and staff going about this?
Well, we're probably going about it much in the same way as most educators across the country are. And we have had the fortune of operating our preschool through high school summer programming to put in place some of the recommendations and guidelines put forth by the county and at the state level. So I feel like we've been honing our practices for the summer, and I feel very thankful for the opportunity to do that with a staff who cares very deeply for the health and well-being of our students and our community. So more specifically, we're in our training week this week with staff to really make sure that we're well prepared for opening day on Tuesday of our school year programs.
Right on. Well, yeah, I'm sure you've had, an interesting summer, and it must have been nice to be able to operate over the summer in preparation for the fall semester. Nettie, how important is it for kids to be back in the classroom?
Well, I think that that's the current topic of the day, Joe. It's really what will be the social and emotional impacts of not being back in school in person. And of course, that's a balance with the health concerns and safety of our school community and our staff and our greater community. We are feeling like operating under the guidelines that are being put forth and collaborating with area organizations who were also running summer programming so that we could share our experiences and share our practices. It's setting us up to provide in-person programming. And at this time, we feel strongly that that's a good move for students. We also feel like it's a good move for families who are trying to get back to work. And if we can provide that live and in-person instruction in a safe way, then we're also creating a healthy balance for families.
Sure, sure. That's been a big adjustment for a lot of families, I know. Well, speaking of, health and safety, what measures is the Discovery Academy employing?
Well, I could go through the whole long list of measures that we've learned and we've read about, and we've reached out to the county health department for guidance around. But I think the top measures that we are implementing revolve around parent partnerships in daily wellness checks and temperature checks of students. We'll be doing the same at the door for all of our students. We're working hard to also isolate our cohorts, i.e. our different program levels from preschool through high school, reducing any opportunities for overlap. We're also obviously implementing a lot of the cleaning and disinfecting protocols that every organization in the community and business in the community is implementing. I think as well, we are really fortunate to be operating with smaller numbers. And so we are able to be in classrooms with social distancing in place, increasing ventilation, working with our building managers to make sure that our HVAC system has the filters needed, and getting kids outside as often as possible.
Mm-hmm. Sure. Well, how many, have you seen an increased enrollment this fall?
We are at capacity right now, and we have a waiting list this fall. I feel like there are a lot of families in the community who are maybe second homeowners who are reconsidering going back to their hometowns because those schools might have gone virtual or in part or fully. And so they're deciding to stay locally for this school year. And so we've been able to meet the needs of some of those families along with local Big Sky families.
Mm-hmm. What do your enrollment numbers look like this fall, and how do they compare to last year?
So we're full across all programs right now. We have 62 students preschool through high school, and our preschool classroom, we are keeping it a maximum of 16 kids in the classroom, and all other programs are between 10 and 14 students. So that's lower elementary, upper elementary, middle school, and high school.
Gotcha. Is that a significant increase from last year?
Well, we've always kept our ratios low, Joe, but we haven't always been full in every program at the start of the school year. So having a wait list is new to Discovery, and yet we have been growing every year. So I think there's some interplay between a greater increase in our local population because people are choosing to stay in the area, and also just a continually growing school program.
Mm-hmm. Nettie, as a private nonprofit school, what responsibility does Discovery have to any county and state educational guidelines for in-class instruction?
Yeah. Well, I guess my first answer would be our responsibility is to the best of our ability keep our students, staff, and greater community healthy. So I would say that's our guiding principle, Joe. But also the governor's mandate for masks and face coverings applies to all schools, private or public. And so certainly that mandate, along with the county guidelines, are what we will be following. There's no exceptionality there, and we would want to be operating as well and as safely as any area of business or school or organization is doing.
Of course, no, that makes sense. You know, you and I have talked a little about, you know, the approach you might take for a teacher, for example, who could get sick. What's the plan there?
Well, I think you're hearing all across the country about contingency plans. Mm-hmm. And feel like on all levels of our lives, we're creating contingency plans. And certainly we at Discovery are doing that. So in any circumstance where a student or a teacher or staff member might need to quarantine or be out of school for 14 days, we're able to have in place plans so that there's a continuity of the educational plan. And so whether it's a teacher who isn't sick but needs to be quarantined because perhaps they were a close contact with somebody who tested positively, we're able to create plans where that teacher will virtual in and we'll have an assistant in place in the classroom to help the students stay on task and aligned with the daily goals and expectations. And conversely, if there's a student that needs to be out for a similar reason, we can create an interface with that student, much like many schools are doing who are offering virtual programming. And we're able to keep that child enrolled in our program virtually until such time that they can return.
Gotcha. We talked about contingency plans. You know, God forbid, you know, how would the school handle any sort of outbreak? And are there trigger points for that?
Well, I'm a firm believer that we need to turn to our professionals anytime there's something that we need to handle in this pandemic situation. And so our first line of defense would be reaching out to the health department for guidance, and we would follow suit accordingly. Mm-hmm. I think there are hot spots all over the community, and what we're all trying to do is operate respectfully with one another so that we can maintain our businesses and maintain our programming, mm-hmm. and hopefully avoid an outbreak. And that would be our greatest objective. And summer was a tried and true approach to that, and we had a very successful summer.
Well, congrats on that. And yeah, you guys are back September 8th, correct?
Yep.
Nice. Nettie, what are some of the ways that Discovery is filling community needs outside of school programs?
Well, I know in some of the previous town hall meetings, you talked about and highlighted the collaborative efforts of all of the area organizations around behavioral health and meeting the needs of any group in the community, any cohort in the community who was impacted by school closures or business closures or sheltering in place. And that group continues to meet. And we have felt really dedicated to continuing to try to find ways to support the community outside of our regular school program. So one role that came up this last spring that was filled somewhat, I guess, not casually, but in a self-directed way by our after-school English language learner instructor who also was working for the school district, lending ELL support to elementary kids, was that our staff person, was outreaching to the greater community of limited English speaking or Spanish speaking only community members. So we're working to formalize her outreach and provide her support for continuing that role, i.e. connecting those community members with community resources, whether it's supporting translation of materials related to their jobs or to school, or connecting them to the food bank, or connecting them to other community resources where the language barrier might be an impediment to their connecting to those resources. So we're collaborating with Women in Action and the YCCF and trying to work to create a formal role for her as a liaison to that community. We're also starting to try to collaborate with some organizations around providing support for working parents who might have kids working at home virtually on their school program on any given day of the week. So while plans in that direction aren't solidified, we have reached out to some organizations and area businesses to try to see what we might be able to come up with by way of some support.
That's great, Nettie. Really, it is continually amazing just to me to watch our community come together in various ways, and people reaching outside of their sort of normal and comfort zones and what's expected, and it's great to see that. So thanks very much for your guys' efforts. Brandon, any follow-up questions or questions from the audience?
Yeah, thanks, Joe. Nettie, I have a follow-up question myself.
Sure.
So obviously things are changed very rapidly regarding the best practices for the COVID-19 virus. But there was a recent directive from Governor Bullock that allows students to remove their masks if social distancing is possible within a classroom and strictly enforced. I'm curious if the Discovery Academy has discussed this option or possibility at all.
Absolutely. So that clarification from the state related to kids being in seats and being 6 feet distanced from anyone else in the classroom. And we're working to set up that scenario so that students can be without face coverings only under those conditions. And so really also working with students to support their putting on masks when they're moving throughout the building or across the classroom, or working closely with a classmate or working with a teacher. So anything that would revolve around small group work and direct instruction with their teacher, of course they would be wearing face coverings. And this applies to kids 5 years and up. So we're setting up our classroom spaces, we're measuring, we're creating table and desk configurations to support that to the best of our ability.
Yeah.
And I appreciated that clarification coming from the state. And, we just have to keep our eyes on those changes and that language and make sure that we're reaching out to the professionals when we're not sure about what some of that language means. And the county's COVID hotline staff are remarkable, super responsive, are willing to take time to have the conversations and to answer the questions. So I'm very thankful for that resource.
Yeah, absolutely. Well, thank you for answering that question, Nettie, and
Sure.
I wish you all the best ahead of next week's opening.
Thanks.
All right. Next up, we have Commissioner Christian. In 2012, Clayton Christian was hired as the Commissioner of Higher Education for the Montana University System. MUS encompasses 16 public colleges and universities within Montana, while serving more than 42,000 students and roughly 2,500 faculty. He's worked in the education field for more than 10 years, and he joins us today to share his knowledge as he and his team navigated returning students to campus this fall amidst the COVID-19 pandemic. Commissioner Christian, thank you for joining us tonight.
Thank you, Brandon. It's a pleasure to be here.
Absolutely. So having been involved in conversations regarding the best approach to the pandemic from an educational standpoint since it reached the US, and ultimately switching to a totally virtual learning model in the spring. How have things progressed from the Montana University system's point of view to allow students to return to campus?
Yeah, thank you for that. And this is all a bit of a moving target, and we adapt and we change. I think, as you said, we started back in January, formed a task force at the MUS level, which at that time was essentially to sort of monitor what was largely an overseas problem at the time, right? And it rapidly hit our shores, and we have adjusted accordingly. I think in March, there was just a lot we didn't know. And I think that really played in the decision to move everything remotely and to do so fairly quickly. We also did it right before we had 45,000 students across the MUS headed to spring break. And we just felt like going to spring break and then bringing everybody back to campus posed some risks that weren't warranted. But so I think we made that decision, and I don't look back on it. I mean, I think that was the right decision for the time. But, I think as a country, certainly as an institution, we know a bit more about the disease now than we do then. We know that it's incredibly problematic, but handled appropriately, we have a shot at trying to manage a population and keep students as safe as possible, and the faculty and staff that serve them. And so we're working to that end, and we've had a group involved really since the remote learning in March. There's a healthy fall task force that was started up, and that encompasses people from leadership roles at every campus to the logistical registrars, people that have to sort of organize this. And we've really worked through plans to change how we do business. And I think ultimately we're very hopeful that we've reduced class sizes, we've spread people out, we've broken sections into multiple sections. We have classes built for 100 students that now have 30 students in them, so we can socially distance, so we can do all the things that we need to do. And to move to that scale over the course of the summer was a pretty significant logistical challenge. So we've been active in moving that way. But I don't profess that we know all that this pandemic has to offer, because we probably don't. But we know more about it now than we did, and I think it creates some amount of comfort that if we can manage our institutions properly and we get cooperation from the individuals that we serve and those serving, that we have a shot at a healthy return this fall.
Yeah, absolutely. Well, you mentioned the MUS coronavirus task force. I'm curious, what were the biggest challenges or factors that your team faced while planning the safest approach to return students to the classroom?
Yeah, that's a good question. One of the challenges I think we have always at a system level is that all of our institutions are not nearly the same. We've got everything from two-year education to postgraduate doctoral research happening at MSU and all the above. So we're not in a situation where necessarily one size fits all, but at the same time, we don't want 12 or 16 different institutions doing things completely different. And how we're going to handle the message around those was really kind of a logistical challenge. How we could build some guidelines that fits most. And ultimately what we ended up doing is create a document that's very overarching, saying these are the 7 or 9 areas that you need to look at, that you need to concentrate on in terms of keeping students safe. And then how you do that really needs to fall to a campus level. So it's sort of a two-step process. We created these overall guidelines, and then we handed it back to the campuses to try to implement their version of what was said in those guidelines, if that makes sense.
Yeah, it definitely makes sense. And on the topic of implementation, obviously, planning versus the carrying out of a plan are two different things. But in your opinion, what are the key factors to maintain student health and well-being while on campus?
Well, yeah. Well, I got to start with probably the number one, and this isn't an easy one. And some have even sort of characterized it as blaming the students or anything else. But to be honest with you, student behavior is going to have to represent a huge part of this for us to be successful. What we've seen around the country in institutions that have tried and it hasn't went well is the students really haven't participated at a high enough level in the solution. And that's not blaming, it's just the reality that we need students to maintain that social separation. We know they're excited to be back on campuses this fall, but it's going to have to be different than it's been in previous. We'll have to have moderations around gatherings and group sizes and interactions. And we need a lot of help there. And I think if we can get help from students and they take that serious, that's kind of the only path forward. We've put a lot of the precautions in place, splitting up classes. I have no idea how many linear feet of plexiglass we've installed over the summer, but it's significant. I mean, we went through the processes. We're monitoring temperatures. We've got all the things suggested by the CDC in terms of hand washing stations, the rest. But none of that makes any sense if nobody uses it and if we don't maintain social separation outside of the classroom. And people talk a lot about campus environment, but 70% of our students live off campus. So how they maintain themselves off campus, and that's not just students, it's faculty, staff as well. We all have to sort of participate in this goal to be back to a face-to-face learning environment.
Yeah, definitely. And, at the end of the day, we're social beings for sure. And there's been a lot of studies going on, regarding the pros and cons and mental health as we went to the fully virtual model in the spring. But I'm curious, what are the greatest physical and mental pros and cons of returning college students to campuses this semester?
Yeah, that's a great question. And I am so incredibly proud of the work that our faculty did and the students that participated this spring in moving to remote and moving there quite quickly. We did the best we could given a tough situation and a global pandemic. But the truth is that isn't what we're built for. Part of our learning experience is that campus environment. And we know that we need that to have students fully engaged in that learning process. We know already from a campus standpoint, the drain on mental health services would indicate that sort of social isolation is not beneficial to the individuals that participate, but it's also not the best learning environment, right? So we looked as part of sort of the decision to try to get back to face-to-face, what all those obstacles are. I think mental health is a significant one. I think just the overall learning objectives. I mean, we have a lot of learning in the MUS that is hands-on, from welding labs to anatomy labs to you name it. That stuff sort of works online. We make the best of it, but that in-person experience, that social interaction, that ability to freely ask questions, to talk back and forth with your lab partner, to your instructors and beyond is a big part of it. And so, I think we tried to factor all of those pieces in. And in the end, higher education is still a choice. And we need students to make that choice, not just for ourselves, but beyond that, for our economy, for the pipeline. Overall, we have a role in serving workforce demands across Montana. And if we lose a generation of college students because they stopped out or they didn't re-engage because of the virtual environment or the online environment, it'll have devastating consequences, both to them as individuals, but also to our economy, to our workforce pipeline. And so we just tried to look at all of those things as they sort of fit together and how we can keep control of them.
Yeah, definitely. While you're discussing impacts to the economy and just impacts overall to Montana, we've obviously avoided any major outbreaks such as those witnessed in New York, Arizona, and Florida. But I'm curious regarding the impact on local communities with college campuses within the state. What arguments were there on both sides of the debate, specifically for allowing student populations to return in person or not this fall?
Yeah, we certainly got feedback on that. And we understand that in both ways. These communities are largely dependent on the institutions that we serve, or the communities that we serve with the institutions. And so that impact of having students in those communities is substantial. you think that that's huge in Bozeman and Missoula, and it is, but it's sort of the lifeline in Havre and Dillon and others. It's a major industry. And so the lack of that is really quite challenging. So there's certainly that piece of it. We understand the health concerns at the same time, and we certainly heard about that. But, I guess practically speaking, and here too, we need the students to help us, but some of the most vulnerable populations probably shouldn't be out in the community, whether there's college students wandering around or not. Those probably need greater separation, isolation, to keep themselves safe throughout. The introduction of the college student to the equation, if in fact we can ask on them and call upon them to maintain social distancing, to behave in that manner, then it doesn't pose a tremendously larger risk than the general population does. And I think that's the calling that we have to answer, and that's what we're trying to balance in these communities. There is, that's just what everybody's working through right now, right? I mean, I think the country's working through it. What are the financial implications? What are the implications to those communities, their economies, and how do you balance that with the health and safety of those community members? We're trying to do that every day, and we're certainly very cognizant of that concern and working to try to keep our students safe, but at the same time, the communities that they're in safe.
Yeah, absolutely. Well, you mentioned that, you yourself and your team have engaged in talks regarding the pandemic since January, and I'm sure you fielded many questions in those past 5 months. But I'm curious, what's been the most frequently asked question that you've received during that time?
Well, it's probably waned since we made our announcement a couple of weeks ago, but without a doubt, are we going to play fall sports? Football has been the number one question asked. Somewhat kidding, but somewhat not. That one certainly was the headliner. Maybe before that, early spring, it was, what about Guns N' Roses and Kenny Chesney? All important topics. And back to your earlier comment, we're social beings. We like those things, and they're good community events. They're good public events. They too have dramatic impact on the economies that we serve in those communities. So it's a fair enough question, but yeah, that one ranked at the top, followed, I guess, not too far behind for how do we intend to keep everyone safe?
Yeah. All right. Well, lastly, Commissioner, I just have one final question, and I'd like to, if you're comfortable with it, go on a personal note. You've experienced COVID-19 firsthand. Can you briefly describe your experience with the virus?
Yeah, I got to experience it up close and personal. Early on, I think I was the 5th patient in Montana, but early on, early March, we had a board meeting in Dillon, and exactly the kind of things we're talking about, and exactly what we probably didn't know about then enough. But we had 150 people in pretty close quarters, moderate ventilation, and lo and behold, myself and I think 7 or 8 of my colleagues ended up sick from that meeting. Yeah, it was, I was sick. Certainly some people have had a wide range. I recovered at home, but it wasn't the most fun I've had, that's for sure. I had a pretty high fever and about as bad of body aches and that kind of thing as I've ever had. But more for me that it was a really busy time, and the energy was really hard to keep up. It sort of zaps you of your energy, but I'm over it now. I can taste and smell things again, and I'm back at it. So all is well, I guess. And for those that get to experience it, I wish them well too.
Yeah. Well, thank you for sharing that story, and we're glad you're sitting here joining us today.
Thank you.
And thank you for your time today, but that's all I had. Joe, is there any audience or follow-up questions from yourself?
Yeah, thanks, Brandon. And thank you, Commissioner Christian. We do have, looks like we have a question from Ashley. Is there a threshold at which the campuses would shut down?
So thanks, Joe. That's a good question. I think start with the reminder that we never shut down. We moved remotely, but for a lot of people, our campus is home. And so we never cleared out the dorms. They remained open throughout. So at the heart of the question is there a threshold that we would move remotely again? And I guess I would tell you that unlike the decision we made in March, I really don't believe one size fits all. I can't really imagine that we would do that at a system level again. Our hope and our objective is that we would continue to manage the situation as best we can on campus. So, with sick individuals, when we get sick individuals, there's a high likelihood that we'll have to shut that class down for a while, as contact tracing will need to run its course and people will need to be isolated. But as they return to healthy status, I would think that we would return to in-person class. And then, you can extend that logic to a building or a facility or a program or a structure. Potentially you could even extend that to a campus if things got bad enough. But our goal would still be to manage the quarantine that's necessary to get people healthy, to manage the population, and then to reopen or remove or move back to face as we can. So I don't think it'll look anything like we did in March, where there's just a broad decision. And I also don't think there's a mathematical formula. The other part of our question is there a trigger? I don't think we've got a number in mind. I think it's just looking at all things that range from infection rates to hospitalization rates to quarantine facility capacity to student and faculty staff behavior. I mean, all those things are part of the overall decision, but I think it would be made much more on a individual basis than it would be a global one at this point in time.
That makes sense. Yeah, thanks for that. One last follow-up from me, Commissioner. There have been some questions and been some articles on whether universities are reporting positive COVID-19 cases. I was wondering if you could just walk us through this process from the Montana University system's perspective.
Yeah, absolutely. So I think one of the things that maybe some people don't understand is that our numbers, we're not an island of ourselves. Our numbers are included in the county numbers. Mm-hmm. So when the state reports county numbers and those brackets that they use, for myself, male in their 50s in Lake County, then that's reflected in the number. But we don't have we don't control the data on our end. And so what we believe is, and some of the articles that have been written about us, we believe that the keeper of that information and the best one to disseminate it is either local or state health officials. They also have the authority to do so under HIPAA and other things. If it's in the best interest of the state to identify potential pockets, clusters, then they have the latitude to do that, where we don't necessarily. So we don't want to dribble out bits and pieces of information that's incomplete. We think that it's best if our information is part of the county's information. We're working with those county health officials to absolutely identify anything that's helpful in managing it. And that includes if there's pockets on campus, then yeah, we should identify those. But it's not, like I said, it's not an island of its own. Our boundaries are very permeable, right? We don't know, we could have a student that's getting tested downtown that has no obligation whatsoever to report a positive case to us. We could have faculty, staff doing the same, or we could have somebody tested on campus that isn't necessarily on campus. I was tested on a campus and had never been to that campus in the preceding month. So, it's just not a nice, tidy package. So what we think is we need to work closely with our health officials and make sure that all of that information is getting out, and so that people can have it together and that it's useful. And if that includes identifying pockets on campuses, then absolutely. But we're working closely with health officials to try to iron that out now. And by all means, we want that information distributed, disseminated as best we can to be helpful. But there's also privacy concerns around that, where we have to be cognizant of that, and we have to let the county do their job. And frankly, I think that that's most helpful to them, because then we don't have people reacting to bits and pieces of information that aren't complete. When they know they have a positive case, then they start their contact tracing process, and they will identify those that have been in contact. And that's easier for them than everybody guessing, well, you know, I walked through a certain building on campus, so I'm going to call the health department and see if I'm sick. It just doesn't, it's not, it doesn't work like that. So we're going to get the information out. We are already disseminating that. Our numbers are part of the others. So there's no concealment. It's impossible. That's all happening by the county. They know everything we know. In fact, when we get a positive case, they tell us, we don't tell them. They're the keepers of the results. They hear about it first, and they would call and say, okay, you have a positive case on a campus.
Gotcha. Clayton Christian is the Commissioner of Higher Education for the Montana University System. Commissioner Christian, thanks very much for taking the time.
Thanks, Joe. Appreciate it. Thanks, Brandon.
Dr. Wadid Cruzado has served as president of Montana State University since 2010. Born in Puerto Rico, Cruzado was a Spanish language and literature professor and was also interim president of New Mexico State University from 2008 to 2009. In 2012, she was appointed by President Barack Obama to the Board for International Food and Agricultural Development, and she's garnered numerous awards for her work in education. Dr. Cruzado, welcome, and thanks for joining us on the Big Sky Virtual Town Hall.
Thank you so much, Joe, for the invitation. A pleasure to be here with all of you.
With approximately upwards of 16,000 students, MSU is about 6 times the entire population of Big Sky, Montana, where we are. You're essentially heading up the equivalent of a town. Brandon touched on this with Commissioner Christian, but I'm curious about your perspective. What were some of those biggest challenges you faced this summer as you and your team prepared to reopen the university?
No, thank you so much. Well, first of all, I need to say, yeah, we have a good-sized university. We're very proud of it. We're also very proud that as the land-grant university, we also have one extension office in each county of the state of Montana. So in that sense, we can truly say that the entire state is our campus, right? And with that sense of profound pride, we also have all the concerns associated with it. Because in a way, we have been monitoring the situation primarily from Bozeman, but not only from Bozeman. We have 7 agricultural centers throughout the state. Again, we have 56 county offices. We have 3 affiliated campuses, and then we have our students, faculty, and staff in Bozeman. I think not too different from what Nettie and the commissioner were saying. First of all, during the summertime, the biggest challenge is the uncertainty, right? Trying to forecast the future, working on 3 different scenarios, not knowing which one is going to develop, right? When do we start classes? Today would have been the first day of classes in a normal calendar. Pretty soon we determined that perhaps what we needed to do was to avoid a similar situation as in the spring, where we dodged the bullet of bringing students back from the spring break, for example. Well, we wanted to do the same thing by just reconsidering the Thanksgiving break. And in that sense, what we agreed was, let's start earlier so that we can provide the same quality of education, but then finish before Thanksgiving. And then when students are done with finals in the fall, then they can go home and they don't need to come back until January. But now it's easy for me to tell you that in a minute, right? the number of data, of analysis, of surveys, of consultation with faculty, with staff, with accreditation bodies was absolutely monumental. And a big shout out to incredible people that we have at Montana State University, because they work very hard this summer. And I will finish with this, Joe. Today we just published the numbers of summer enrollment. And I'm very proud of the fact that we had the highest FTE enrollment in 20 years. So we had more students taking more classes during the summertime because maybe they were bored back at home, but they decided to do something very productive, which is to accelerate their curriculum and their time to graduation.
And those were up about 12%, is that right?
12%. Good job, Joe. Yes.
Well, thanks for that. You know, you did talk about starting classes August 17th, 2 weeks early, ending the semester 2 weeks early, you know, on November 25th. Just briefly, if you could talk about some of the other precautionary measures the school has taken this semester.
Well, again, pretty much what the commissioner explained. We took every classroom and we reduced the seating capacity to 30%. So that means that there were a number of classrooms that, due to its size, we were not able to use.
Sure.
So we needed to move. We're teaching classes now in ballrooms. We're teaching classes in theaters. We're making very judicious use of every space so that students feel safe. We went ahead and we strengthened our requirements for face masks. So we moved from first strongly recommended wearing masks to now requiring masks anytime that we are indoors. And a couple of weeks ago, when students were back, I invited them, let's step it up. Let's wear that mask anytime that we are in campus. And it's very rewarding for me as I walk around campus. And I thank students for wearing their mask even if we are outdoors. So it's a matter of being vigilant. It's a matter of also conveying the right message to students. For example, reminding students that the virus doesn't take weekends off. I know that they want to be together at parties or take long road trips, but everything within measure can be accomplished, but not everything will be able to be done as we used to. And,
Sure.
you know, a week ago, on the terms of precautionary measures, I met with all our Greek life groups, all the sororities, all the fraternities, and we had a profound conversation because, quite honestly, it works well, or it works better if they are the leaders of this message, right? If it's not that me pushing down that message to them, but they saying, we're going to wave this flag. This is something that we can get done. So I have been reaching out to student organizations, their leaders, our very own student body government, and they are the ones driving this message home. They want to stay in campus. That's one thing that all of them have in common. We're so happy to see them back. They are elated to be back on campus, and that's what we all want to have.
Absolutely. Yeah, you know, you basically did answer my next question, but you know, contact tracing across the country has identified student parties and get-togethers as you know, sources of outbreaks. You know, Commissioner Christian mentioned social separation outside the classroom. I'd just like to dive into this a little more. You know, where is the line of responsibility drawn between the university and its faculty and staff and the students regarding safety and allowing classes to operate in person this semester?
Yeah, well, I like to believe that it's a shared responsibility, and therefore I have problems when sometimes we start talking about just the students, right? This is human behavior. This is not just young people behavior. And we fail every time that we generalize. There are adults that fail to wear a mask. There are adults that are resistant to these precautionary measures. And by the same token, I have very mature students that one of the good things is that they write to me constantly and they tell me, right? Today at my class, students were not wearing masks, and then we can continue to nudge them. I think that the answer is, what do we want as a society, right? The last few months have been very difficult for all of us. Even if you have been fortunate enough not to get sick, or anyone in your family members or your loved ones have not gotten sick, or a horrible thing happened in your family, we all have a profound sense of mourning, of we have lost our routines, the little satisfactions of life, going out with your family for a Sunday brunch, or going out with your friends to a bar. All that has been severely curtailed. So we have recognized that each of us holds the key to your health, to Clay's health, to people that we don't know. And we now have discovered that in our own very way, we can be agents of transformation. If we all do our part, then we minimize risk. We are able to flatten this curve and keep these numbers down.
Mm-hmm. I'd like to go into that just a little more if I could. So I'm an incoming freshman at Montana State University. I walk in. What does an in-person lecture hall look like this fall? I mean, is it very similar to what it was? Obviously, there's some distancing, and you mentioned masks, but any other specifics that you could kind of give us a picture of what a lecture hall looks like?
Well, Freshman Joe, first of all, the experience started when you arrived in campus. In previous year, we would have moved all 3,500 freshmen in one day. We would have called it moving day, right? This year, it took us an entire week. We moved it from moving day to moving week. And that is because from the get-go, we wanted to send the message that this year is going to be different. We're not going to congregate. We eliminated a number of rituals and traditions. We used to have Catapalooza, which was this thousands of students just signing up for clubs and associations. We moved all that online. So you will find signage. If you are staying with us in one of our residence halls, the first thing, as soon as you walk in, you're going to have a station so that you can sanitize your hands, that we're going to take your temperature right there on the desk, and then you can go forward. You know that you cannot ride in the elevator with one more person. I mean, it's going to be just you. It's just those little things that we hope that we create an awareness and a habit. Then when you go to class, it's the same thing. You will find that each class now has a chart, and there's a map and of how the tables and chairs need to be lined up, and they don't move, right? If it happens that we have left the chairs there, then the chairs are properly identified as to which chair can you sit on. Same thing, we're going to be wearing face masks. Faculty members the first day of classes would have told you, these are some of the things that we expect. And more importantly, and I don't think that we have touched base on that a lot, but we keep repeating, students, if you detect any symptoms, let us know. Mm-hmm. If you have any symptoms, there's help, right? Let's go to the university health partners. Last Thursday, for example, thanks to the commissioner and to the governor, we received some funding from the CARES Act, and we were able to open the Symptomatic Student Center. testing center. So that is exclusively for students, for you, freshman Joe, so that if you have a headache, if you're running a fever, then you're going to drive or walk to this offsite right by the stadium, right? We're trying to avoid contact as much as possible. And you will be tested for free. And not only that, then you will receive detailed information. We're going to isolate you. You're going to be on quarantine. You just go to your place. We get a pack with your clothes and things, and we will take care of you, right? We will deliver food for you while you wait for your tests. The good thing is that thanks to the testing center that we now have, we're receiving results in 24 hours. Wow. So the quarantine is not extensive. And in all likelihood, good Joe, freshman, you will go back to your residence hall because you received a negative result.
How is that going? I read about, that you received this money from the CARES Act and opening this clinic. How is it being received, and how many students are taking advantage?
It's been very well received. So we announced it on Thursday morning. We said that we were going to open it at noontime. And we had about 11 students take advantage of that opportunity, about an equal number on Monday, and then again today. One thing that we have done is that every communication that we send to students, but we also send to faculty, to staff, and we also communicate directly with parents. Same thing, we ask parents to just help us be in a team at this time. Please remind your son or your daughter that there is help available. If they feel that they have some symptoms, please don't hesitate to make use of this. So it's moving apace. The other thing I'm very proud of the students is that they're being very judicious. It's not, they're not using this out of curiosity, but rather, if they have a symptom that they can be confused whether this is an allergy because the season is changing or is something else, they're not taking any chances. They know that they can do that, but they are not using it just for the fun of going and testing.
Thank you for that. Yeah. Go just about the symptomatic, asymptomatic side of things. CDC recently pivoted its guidelines, and MSU is not offering surveillance or asymptomatic testing. Is that because of these adjusted CDC guidelines, or are there other reasons?
Well, there are two things about that. MSU is offering surveillance for the state. So a few weeks ago, if you remember, Governor Bullock reached out to us to see if we could help processing some of the surveillance testing for the state. Sure. And that is another thing that this virus has taught us, is how to be nimble and how to just, we have always been hardworking people, but now we do it very, very fast as well. So we are doing that thing, surveillance for the state. We are in the process right now in conversation still with the system, and that is still a possibility that we are contemplating with this task force that the commissioner put together. So it's not that it's surveillance, it's not done now because we didn't do it at the start of the semester. There are several methodologies that are available. Wastewater testing is one of them. And but we're still in that process of finding what is the right decision for each of our campuses before moving forward. Got
it. Now, thank you for that clarification. Lastly, Dr. Cruzado, okay, it's spring 2021, fall 2021. In your estimation, what does the future look like, and where do we go from here?
Well, this situation has shown us again how much we appreciate each other, how important higher education is for Montanans, and what a very important role we have to play in society. We always take special pride on the fact that we say that every day we do 3 things with excellence. We educate with excellence, we do research with excellence, and we do outreach with excellence. And during this crisis, I can tell you, we have been blasting off from every cylinder. We have been, our researchers have been there on the front line, lending us their expertise. Our county people, again, through Extension and others, they have been out there disseminating accurate scientific information for our communities. And our faculty members have found new and innovative ways to teach our students. So what's in the future? It's just that recognition that higher education is the answer and the solution that we need. One last thing that I will say, kudos to the younger generation that's coming up. Right now, applications and interest in medical fields, in nursing, in healthcare professions is off the charts high. So while there might be some of these incredible challenges in the future, we know that universities have the answer for those challenges, and we are in a very good path. It's a great place to be.
Oh, that's fantastic. President Wada Cruzado, thank you so much for your help. Brandon, any follow-ups or audience questions that you have?
Yeah, thanks, Joe. And thank you, President Cruzado, for your insight. I do have one audience question from Cheryl. You just mentioned the research that MSU is doing. She would like to know if you could talk a bit more about MSU's participation in vaccine trials and virus research.
Well, we have a number of faculty members who are very involved in many of these initiatives since day one. We have a great microbiology program. We have, goodness, for decades, we have an emerging diseases group. So they have been on the lookout for a pandemic. So while some of us were surprised back in January about this virus coming to our coast, they all knew right before us that this was just a matter of time. We have a faculty member, for example, Blake Wittenheft, who has been very involved in wastewater testing. And he was one of the first ones who were able to tell us in Gallatin County when a surge was coming. So it's almost like being right there at the forefront. Michelle Flanagan and others have been working hand in hand with Bozeman Health Hospital. So they are part of their team who's working on the vaccine, working on prevention, working on some medications. So that's the one of the most important things. We are about to announce that this last year, research expenditures experienced another spurt of growth at Montana State University. So while it's true that these are challenges, how rewarding it is that we are surrounded by incredible professionals, researchers of a high caliber that could be in any extraordinary university or hospital in the world, but they are right here in Montana.
Yeah, definitely. Well, thank you again, Dr. Cruzado, and I wish you luck with the remainder of the semester.
Thank you so much. Thanks for the invitation.
Thank you.
No problem. Dr. Dustin Shipman is entering his 6th year with the Big Sky School District. The superintendent earned his doctorate in education at Montana State University, as well as 2 master's degrees in educational leadership and international education from MSU and Framingham State University. He previously held the role of director at the American International School of Vilnius. He enjoys traveling and the array of outdoor activities that Montana has to offer with his 2 sons and wife. Dustin, thank you for joining us once again.
Thanks for having me. I would just want to quickly say to Dr. Cruzado, you actually robed me in 2011.
All right. So first off, Dustin, today was the first day of school. How was it?
I mean, it was great. It's what we've been waiting for since March 15th, you know, to have students back on campus, even to the limited degree that it was today. But it was really refreshing. It was great to see the parents back on campus. It was great to see students back on campus. We had a week with faculty last week that had a lot of enthusiasm around it for the moment that we had today at 8:30 when we greeted the students.
Yeah. Do you believe it'll be hard for yourself, faculty members, and students alike to grow accustomed to seeing each other with masks on as they walk the halls?
I mean, I think it's going to be challenging, but I think, you know, really, Brandon, that challenge is going to be overcome relatively easily because it's what we've all wanted. You know, all the data that we received from every survey that we sent out was kids on campus to whatever extent is safe, responsible, and beneficial.
Yeah, definitely. And, you know, you've only got a small sample size being that today was day one, but what do you believe will be the toughest challenge as you safely return students to campus?
I mean, I think it's what everybody else has already mentioned, and it's all of us coming together as a school community and as a wider community to really practice best practices, which we know what best practices are now a lot better than we did back in March, to practice those best practices so we can move to a more occupancy on campus as the year starts to unfold. I think that's going to be the biggest challenge. But, you know, we have some real leaders among our student body, and that was one thing we heard over and over from our consultant from Matrix, and Dr. Cruzado mentioned it, so did Commissioner Christian, and that's putting this in the students' hands and having them hold each other accountable and, you know, practicing those practices when they leave our campus, when they go home, when they go to their soccer practices, when they do their activities. That's going to be one of the keys to overcoming this and coming out better on the other side.
Yeah. Yeah, and you mentioned putting it in the students' hands. I'm curious, what initial feedback did you receive from staff members and students today?
I mean, the same as what I said. Everybody was really, really enthusiastic. You know, again, thinking we haven't seen the students on our campus for, you know, almost 5 months. So there was a lot of excitement around being back on campus. So everybody was excited. We had a debrief at the end of the day and another task force meeting, and everything that came out was enthusiasm.
That's great to hear. On the flip side of that coin, you know, obviously there's the excitement, but I'm curious, what will be the course of action if a student or staff member were to become ill and they had been on campus?
Yeah, again, I think, you know, and just to reiterate, working with the Gallatin County Health Department. So we've been working very closely. The superintendents from Gallatin County meet with the Gallatin County Health Department weekly, and we've been meeting weekly for upwards of the last 6 or 7 weeks. And so we feel very confident in their abilities to work their system for contact tracing, for communication, for all of those things. And, you know, certainly we'll be there to offer and lend any support or anything else that we possibly can.
Yeah. I know it's still the early opening, but how does the Big Sky School District currently plan to handle meal services?
So we started meal services today. The biggest changes really are, you know, how parents are going to sign up for meal services. We're asking for a few different things just so it's more predictable. And then, you know, students are going to, the meals are being delivered to the rooms or delivered to certain wings of the building where student helpers are then helping to deliver those meals and get them in the hands of the students who have requested one. So those are the biggest changes right now. We're still continuing our farm to school program. We're still continuing to serve high quality meals day in and day out, which was something, you know, that we were extremely proud of through the school shutdown too, was, you know, we were serving upwards of 60 to 80 meals a day to our students. Some of those, you know, vast majority of those delivered right to their doors.
Yeah, definitely. And you mentioned parents and the meal services and trying to streamline the process. But I'm curious, how can parents assist with the cleaning and sanitization protocols that the school has adopted to best keep their children safe?
I think it's just really supporting the protocols that we have in place, reminding kids and teaching those things at home too, teaching what good hand washing looks like, reminding their students when they drop them off. Because at this particular point, we're not allowing parents into the building, only by, via the office for special occasions or special reasons, but really encouraging the kids, when they drop them off, don't forget to sanitize your hands. Don't forget to put your mask on, your face covering on when you enter the school building. And then again at home, just reinforcing the things that we're doing at school, because that's a safe and responsible home behavior as well.
Yeah. Well, obviously everyone wants to be back in person in some form or fashion, but if BSSD had to adopt an entirely virtual learning environment once again, at any point during the school year, would there be any significant differences in regard to what students experienced as opposed to the spring?
Yeah, we think that we learned a lot. I'll just say that. And I actually think we launched probably one of the better virtual environments or distance and virtual learning environments in the state of Montana. However, we did learn a lot. The biggest difference is going to be, because we're not just preparing Brandon for just in case the entire school has to close down. We're preparing for the kid or the teacher or group of kids who may have to quarantine for 14 days. We still want those students and those teachers, to the extent they can be, to be engaged with their learning, with the teaching and learning that's going on. So the biggest thing that we've done is technology upgrades to lend itself to more synchronous learning. So we have a high ability now to broadcast out and a high ability to broadcast back in. With that, we've also worked with the staff to really distill down, the standards and really hone in on the learning process and what's really important about coming out of a lesson.
Yeah, absolutely. Well, referring to technology, can you elaborate a little more? You discussed the broadcast capabilities, but any other technology that the school has implemented this year?
It's the audio and visual systems that are now in every teaching space in the district. And that was the biggest challenge that we had before. And then also so we have all the technology there and we have the ability to have, essentially if we needed to, a teacher teaching to an empty classroom, but really teaching to a full classroom, outside of the bricks and mortar. So the biggest tech upgrades we made were those two things, the visual and audio capabilities. And then we were in great shape technology-wise before anyway. But the other thing that we've done, we've adjusted our policy so now students can bring their own device from grade 6 to 12. That used to be high school only. And we've gone one-to-one take-home. We were always one-to-one, but one-to-one take-home all the way down to kindergarten.
Wow, that's really cool. I touched on it earlier with Nettie, but referring to the recent directive from Governor Bullock that allows students to remove their masks if social distancing is possible and strictly enforced, has BSSD discussed this option? And if not, is it on the agenda for further discussion at any upcoming school board meetings?
Not at any upcoming school board meetings, but it certainly has been talked about amongst the task force, and it will continue to be talked about amongst the task force. I mean, one of the things why, we went to an every other day schedule, there's a few things at play there. So every other day, 50% of the students are going to be on campus, 50% will be learning in the virtual environment. One of the big things was, our enrollment really ebbed and flowed over the summer, what we were expecting, and we still don't have a solid number. So that's 6 foot. So we had a consultation from Matrix Medical, who came in and really walked us through the facility and really talked us through those things. And, we wouldn't have been able to accomplish social distancing in all of our teaching spaces and do it safely. So that's why we've made the choice now. We're social distance because we know social distancing and a face covering, those two things in combination are, right on the front lines of the safest behavior that you can exhibit in your school. So that's where we're at right now. We didn't have the facility for it.
Yeah. You mentioned enrollment, being that this was the first day. Did you have a lot of unexpected attendees, so to speak, I guess?
We had a few unanticipated attendees. And we also had, just in today, five paperwork packets go out. So we're still getting students enrolling. Today we're at 425, and last year we were at 370 at this point, 374 or something. So, well over 10%, closer to 15%. We think we'll probably level out right around 430 K-12.
Mm-hmm. Yeah. Well, now I'd like to shift gears just for a second. Are there any updates that you can provide at this time on the school expansion project that was funded by the levy that was recently passed?
Oh, thanks for giving me something really great to talk about. So the architects are working through some initial design phases where the geotech analysis is going to start next week. So we'll be able to probably have some designs out to community for feedback. We're hoping in November, some real design that the community will be able to see. The housing project is, I don't know if anybody's been by that lately. The second unit has the walls up, has the trusses up, and is ready for shingles.
That's great news. And lastly, I hope that I've been able to cover many questions that community members and parents may have this evening, but I understand there's an email address that people can submit questions for the school district to. What is that email address?
That email address, Brandon, is backtoschoolsafely@bssd72.org.
Perfect. Well, thank you, Dr. Shipman. That's all I had, but I would like to toss it over to Joe and see if he has any follow-ups or any questions from the audience.
Yeah, I do. Thank you, Dustin, very much for your time today. Something that I continue to think about is how distracting all this has got to be for students learning how to learn in a new way, right? I got to think it's hard for them to concentrate. I mean, it's early days yet. It's day one, so we can't get ahead of ourselves here. But, are there any, I was curious, are there any special training that you guys are giving to, guidance counselors who may get questions surrounding, issues about distraction and difficulty concentrating?
Yeah, so we feel like our guidance counselors are quite competent, and I know they participated in some, COVID related and new ways of learning workshops over the summer. Mm-hmm. But so this week we've had a graduated start where we have just very small cohorts of students into the school, and this is the week where we're really going to work with the students, because when we say distraction, face coverings are a distraction. Washing your hands all the time is a distraction. Using the public restroom only in particular blocks of time, that can lead to a distracted learning environment. Mm-hmm. So this is the week where we're really going to work in small groups with students to really, I don't want to use, to teach them that these are the ways we're going to interact now on our campus. And then certainly we'll be keeping a very, very close eye on students and how they're behaving in the environment and how they're reacting to the environment, and respond to those as needed and as a priority. Because, one thing, and I think Dr. Cruzado mentioned it too, the mental and emotional and social well-being of the students is extremely, extremely important. And that was one thing that came out of last spring, the governor's closure, was there's a lot of those that just happen organically, that students become healthy in all of those areas just through being social. Yeah, I definitely hear you there. And I'm sure it's tough as well on you and your faculty and your staff. I really appreciate what you guys are doing. I know is a heavy lift for you all this summer and as you go forward through the semester. And we really appreciate everything you guys are doing for our young students in the community. So thanks again for your time, Dustin. Thanks for having me.
Maren Dunn is board certified in family medicine. Dr. Dunn has lived in Big Sky for 9 years and has worked in rural family medicine since 2005. She is the board president at Morningstar Learning Center in Big Sky and has a first grader currently at Ophir School. Dr. Dunn, thank you very much for joining us this evening.
Thanks for inviting me.
Yeah, of course. Let me just start with maybe just an obvious question for you. Is it safe for kids to return to the classroom right now?
So that is the question of the day. That has come down to essentially two items. Number one, the number of COVID exposures and COVID numbers in the community. Mm-hmm. And then what are the schools doing to mitigate that possible spread? You know, Gallatin County has done a great job, and Big Sky is also low in the COVID numbers in terms of flattening the curve. So in that regard, our numbers are low. So that is a good reason why children should be able to go back to school. Secondarily, our school's done a great job. Both of them have done an excellent job in mitigating the risks. They've followed all the CDC recommendations. They've taken it to the highest level, also in terms of the risks that are inherent for kids that have high risk, that are high risk themselves, or maybe live with high risk people, in that they can stay home. So I think that answers your question. It does come down to numbers in the community and what schools are doing about it.
Sure. Talk a little about what you think are the pros and cons to returning to in-person learning.
Gosh, the pros are far outweigh the cons, especially for the young kids. But I think it goes all the way through the college kids, as we've heard from both others on this panel. The kids don't just go and read and write and learn math. They learn social and emotional skills. They get social support. They get to go outside and play. They are fed. These are all really important public health components to a healthy community. A lot of times, and even in our community here in Big Sky, school is a safe place for kids. You know, they'd be home alone otherwise, and that's not always advisable. So I think it's important that the kids go back to school. I think that the CDC and the AAP are both very much in fact, I know they're both very much in favor of schools as long as it's safe for children to return for those reasons. Mm-hmm.
Dr. Dunn, what are you seeing in Big Sky right now related to COVID-19 cases?
Not much. I mean, we have been very, very lucky in the county, in Gallatin County also. Our surge, if you could call it that, is mild and minor compared to the surges that you hear about on the television. And I don't think it's just because our population is small. I think it's because people did the right things. We did completely flatten our curve before opening the state back in June. Mm-hmm. So we knew what to do. And I know that as a local person here in Big Sky, and my friends who are locals and people who locally live here, we hunkered down even when the droves of people showed up. We didn't go out. So all of us, especially with children where we want them to go back to school, where we wanted the daycare to stay open, have followed the guidelines.
Yeah, that's great. Today we talked about is Big Sky School District's first day back in school, and you have a first grader at Ophir. She was in the 50% of the students who stayed home today, so tomorrow's her first day. Ruby, right?
Yeah.
How's Ruby doing? How is she handling some of these complicated times?
I have to say that I have been more than impressed. I've been blown away, actually, not just by my own daughter or her friends, but all of the children that I meet through my practice, at how plastic they are, how well they can accommodate for changes, how well they communicate, how attuned already to, the online environment they were to begin with. Mm-hmm. I think that also speaks to their relationships with their teachers. And I can't speak enough to the teachers and how much they did to make that easy for our kids. And so my kid's not afraid to go back. She's not worried that she's going to go one day and come back and do online the next. It's just what she's now used to. And the teachers really have a lot to do with making that a simple process, even for us parents who are not teachers but have become teachers, and for the kids.
Yeah. Yeah, absolutely. You know, it's interesting. You talk about, you know, we talk about the students and the, you know, the difficulties adjusting to distracting times and, you know, washing your hands out every 3 seconds and masks and distancing. You know, I think that's something that's maybe a bit overlooked too. I'm sure, you know, teachers have had a very difficult time with this, and you probably have some. We both have friends in the school district, and how are the teachers doing from what you've been able to notice?
Again, all I can say is that the entire education, that part of our community is remarkable. Resilient, remarkable, energetic, excited. I saw Ruby's first grade teacher at the farmer's market, and she was practically jumping for joy to tell me that, you know, for us to be excited, we were all excited that Ruby was going to be in her class. You know, it's exciting. It's always an exciting time to go back to school. I don't think it matters whether you're a college student or a kindergartner. So the teachers that I'm aware of, they're ready to go. This is what they do. You know, they solve problems, they develop curriculum, they pull the kids out that fall into the cracks. And that's all I have seen. Sorry about that.
Okay.
That's all that I have seen from my perspective.
Well, I just want to jump back into you know, some of the government protocols and directives. You know, the CDC recently changed its guidelines from encouraging those who have been in contact with known cases to get tested. Now, the CDC is discouraging these folks who are asymptomatic. I was wondering if you could just if you could give us your take on this change.
The change has a lot to do with the burden on the medical community, essentially. I mean, when you talk about testing someone, you are getting that very specific second in time. Whether or not they have the virus could change within an hour, whether it shows up on a test. So the test is really not relevant. What's relevant is how smart are these people being that are coming in contact with folks who we know are positive? Are they quarantining, relative quarantining, whatever they feel is appropriate to the amount of time they spent or how close they came to that person? And are they doing their own due diligence to quarantine? And if they were to become positive, by all means, test. Testing asymptomatic people has just not been proven very useful. It certainly isn't changing the rates of exposure, and it's not changing the rates of escalation either.
Yeah. Interesting. Yeah, because they are doing it to some degree on the state level, and MSU is considering those, but I can see where you're coming from in that it's a snapshot in time and it doesn't help you yesterday or tomorrow.
And this is also, I mean, the CDC made a specific recommendation for schools, and that's because their expectation is that schools are going to be following all these precautions. In other places, such as in Big Sky, where there are large construction sites, that's a different story. That is not a school where precautions are being taken. And should those people be tested asymptomatically? Well, that's going to be up to that organization. That's a very different picture. We're just talking about schools today, so.
Sure, absolutely. And yeah, okay. Talk to me about just the importance of wearing a mask. And are there contraindications for masking up?
So the American Association of Pediatrics recommends starting at age 2. The children that shouldn't wear it are either under the age of 2 because they really can't manage a mask. They can't take it off if need be. Or other kids who are not able to function with it on, can't take it off, can't take it on, put it on, things like that. So by and large, 99% of children can wear a mask. The purpose is to limit the amount of respiratory droplets that travel into the air. The more we do that, the less likely a virus is to travel. Also, the less likely the recipient of that virus, should it be in the air, is to get a very high dose. And we know that COVID-19 illness is much worse in people who get a larger dose of virus than those who get a lesser dose. So you're not only protecting yourself, you're also protecting others.
Mhm. Yeah, no, absolutely. And a lot of people have pointed to the respect factor there for people who may, have underlying conditions. Well, look, Dr. Dunn, thank you very much for your time today. I'd like to kick it over to Brandon just for any follow-ups or audience questions that we might have.
Yes, thank you, Joe. Dr. Dunn, I'm curious on a total personal note. Will Ruby be taking her back to school photos with or without her mask?
That I don't know. I guess Dr. Shipman, will they be taking class photos without their masks?
Oh, I think you're on mute there.
That's yet to be determined. But a lot of parents took them with and without this morning at the sign when they were dropping off.
Awesome. Well, thank you.
It seems to me that's going to be a rite of passage for 2020.
Yeah.
Well, thank you for your time, Dr. Dunn. We appreciate it and wish you the best of luck with everything this fall as things continue to progress.
You're welcome. Thanks for inviting me.
Yeah.
Thanks, Dr. Dunn.
Well, I'd like to once again thank our sponsors tonight, the Bozeman Health, Big Sky Medical Center, Shore to Summit Wealth Management, and the Big Sky Chamber of Commerce. I'd also like to restate our gratitude for the panelists who joined us this evening to share their knowledge and insight as students return to campus in this uncertain time. As we independently continue to educate ourselves on COVID-19, teachers and professors and all other staff and students are forging on to educate the next generation of young adults readying to enter society. We hope that we were able to address many of your questions and concerns this evening, but please remember, as schools reopen, we are all beginning to learn these new paths in education together. Before we conclude this evening's town hall, the EBS and Outlaw Partners staff would like to wish a full and speedy recovery to Lauren Bao. Get well soon, Lauren. Thank you for watching and have a great evening.